Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, in the chemotherapy, we give tamoxifen to the patient. So, what is tamoxifen? Tamoxifen is actually a standard hormonal treatment mainly for the breast cancer, and it is given in both premenopausal women. It can be given in premenopausal women and also in postmenopausal women. Also, we can see this. This tamoxifen is actually effective in ER positive breast carcinoma, and even some ER negative breast carcinoma also responds. Some ER negative breast tumors also responds to tamoxifen, but actually it is for ER positive breast carcinoma we give tamoxifen. Then this tamoxifen is actually approved for primary prophylaxis. It is approved for primary prophylaxis of breast cancer in high risk women. In high risk women, it is approved for primary prophylaxis of breast cancer. It will reduce the recurrence rates of the breast cancer. It will reduce the recurrence rate of the breast cancer, and this recurrence rate of breast cancer is reduced both in ipsilateral breast and contralateral breast. Okay. Then it also reduces the risk of breast cancer in the contralateral breast also. It reduces the recurrence in both ipsilateral and contralateral breast, and it also reduces the risk of breast cancer in the contralateral breast. Next, what is the dose of tamoxifen given? Tamoxifen is given as 10 milligrams BD dose. It is given for 5 years. Then this tamoxifen, how does it work? This tamoxifen will block the estrogen receptors which are present on the breast, and it will stimulate the estrogen receptors which are present. It stimulates estrogen receptors in the uterus. It blocks the estrogen receptors in the breast and stimulates estrogen receptors in the uterus, because tamoxifen is actually a selective estrogen receptor modulator. Okay, because it stimulates estrogen receptors in the uterus, it can cause endometrial hyperplasia, and it can also lead to endometrial carcinoma. And thus you can say that tamoxifen is actually a selective estrogen receptor modulator. So it has a potent antagonistic action is present in the breast carcinoma cells. It has a potent antagonistic action in the breast carcinoma cells, in the blood vessels, and also at some peripheral sites it has the antagonistic action, and it has partial agonistic action is seen in the uterus, bone, liver, and pituitary. Okay, then what are the side effects of tamoxifen? Side effects of tamoxifen is this: tamoxifen will cause retinal deposits, it can cause decreased visual acuity, cataracts occasionally in these patients. It will also increase the risk of thromboembolic events.
thank you and thank you for watching.